A great question is, can an IOL be removed or replaced, in intraocular lens? And the answer is yes, it can. And often it can be done very quickly and easily. So an intraocular lens is put into the eye after we remove your natural lens. It sits inside the structure or really the capsule or the skin that used to hold your original lens. And as time goes by, nothing really changes. Maybe there's some scarring that happens around the lens, but if you felt like, I think there's this new lens, I want to give that a try. My friends have been raving about it and very happy in it, and they're out of glasses for everything they do. Then yes, you can come in and visit with us and see if that would be a good option for you. We do this surgery quite frequently, like we have said before. 1 in 20 patients or so can be off target. I think the odds are actually much lower than that, but 1 in 20 is sort of the standard book statistic. So what we can do is at the 3 months mark, after things have stabilized and the lens has settled into its effective lens position, that variable in the equation. So once that becomes a constant, and we know that your numbers are not changing anymore, we can then apply our measurements and back calculate the lens power. And then once we've done that, we can simply remove the power and the lens inside your eye and then replace it with a new power to achieve an optimal result. Yes, so to me, I've removed lenses that have been in the eye for 20 plus years with no issue. Oftentimes those lenses have scarred up behind them, and the laser has been applied to remove the posterior capsule. So the surgery becomes a little longer when that happens. So after you remove the lens, because the posterior capsule, which used to be a barrier for the jelly in the back of the eye, the vitreous, now it's absent. So the vitreous can and probably will come forward during the surgery. And then what we do is we have to clean that jelly up. It's an invisible jelly. We clean it all up, and you have to do that because otherwise, this jelly is going to be in the way of this lens positioning well inside your eye. So two things can't occupy the same space, right? So this is called a vitrectomy, anterior vitrectomy. We can do that. It adds another 10-15 minutes to your surgery, but not a big deal, very easy to do. And then we can simply just put in your choice of another lens into the capsular bag. You can choose a multifocal lens. You can choose another monofocal lens. You can choose a light adjustable lens. We can put anything in there. Anyways, so the answer is yes. You can change your mind about lenses, and we can remove them and replace them. And even down the line, let's say 10 years from today, despite putting in the very best lens, let's say a PanOptix Pro, 10 years later, there's a new lens, let's say the perfect lens. We can, remove your existing lens and then replace it with the new lens. Now, that's I don't think any surgeon is going to do that for free, and that's almost never covered by any guarantees or warranties to your original surgery. It is a completely separate surgery, but it can be done, can be very safely done. Thank you.